Hi there and welcome to News. Today on News we have a very important topic, adolescent substance abuse. So, to describe it according to the DSM-5, substance abuse disorder is marked by significant disruption in one's education, job, or relationship with others, as well as situations that put you in physical danger. So the five main categories today that we're going to focus on, each with its own unique statistics and effects, are going to be depressants, such as alcohol and Xanax, stimulants, nicotine, cocaine, Adderall, opiates, which are heroin, codeine, Percocet, and other opioids, hallucinogens, such as acid or LSD, and others which don't fit into the category, such as inhalants, anabolic steroids, and others. So, before we get into the meat of our broadcast tonight, I'd like to discuss a few differences between adult and adolescent substance abuse. First, drug use at an early age is a very important predictor of development of a substance use disorder later. When affected, they look largely the same. So adults and adolescents look very much the same when they're affected by the drug. And they often have similar addiction patterns, but with some marked differences in outcome behaviors, such as that are kind of unique to that age group, such as problems at school for adolescents versus problems at jobs for adults. So they also differ in a few unique ways, such as they differ in what drugs they use, like which ones are most popular. When adolescents drink, they are more likely to binge. They are less likely than adults to experience withdrawal symptoms, but adolescents are more likely than adults to report hiding their substance abuse, getting complaints from others about their substance abuse, and continuing to use in spite of fights or legal troubles. A few other risk factors that are kind of unique to adolescence is the lack of parental supervision and availability of drugs at school. These can both play into substance use and substance abuse disorder. Other risk factors that adolescents might face that are also similar to adults are aggressive behavior, poor social skills, drug experimentation, and community poverty. Now we turn to Rebecca to give us more information. Okay, and we're back. Thank you to Camille for that riveting report. So now I'd like to conclude this broadcast with talk about the different outcomes that adolescents face with their substance use. First, their behavioral outcomes. Adolescents may face family relation issues, such as fights or loss of relationships with families. They also face delinquency. With some of the drugs we've described today, they are illegal substances, but as well as adolescents can get into legal trouble while using them, such as delinquent behavior, graffiti, things of that nature. Other outcomes are poor school performance and attendance, psychological outcomes. These substance abuse disorder may be comorbid, with depression, anxiety, post-traumatic stress disorder, suicide, other mental health issues and disorders. And depending on the drug and the usage and prevalence of that drug in the adolescent's life, they may have severe health effects such as lung trouble, heart trouble, and the list goes on. So some of the treatments that go on inside of school that are limited include school psychologist support, social support from within the community of teachers as well as students, an online relapse program, which I will get to later. But as you can see, this list is not very expansive because this disease and related diseases to substance abuse need to be treated outside of school because of the severity of the nature of this disease. So outside of school, there are four proven evidence-based approaches that are effective or generally effective for adolescents. And again, these are supported by research. So the first is behavioral, and these include examples such as cognitive behavioral therapy, motivational enhancement therapy. And what these do is they try to work with the cognition of the adolescent to modify attitudes and behaviors to become less likely to use the drugs and engage in the behavior that leads to using the drugs. The next one Oh, and also group therapy may be used, but it's found to be not as effective because some social interactions may actually increase the usage of drugs within the group therapy, such as idolizing euphoric or other moments on drugs. The next evidence-based approach for outside of school therapy for adolescent substance abuse is family-based approaches, and these are generally cover a wide array of problems within the individual. So it really covers. It's more of a holistic interpersonal route. So it covers things such as their substance abuse problems, obviously, but including family communication and conflict, resolving that, co-occurring behavioral mental health and learning disorders that may inhibit thinking or may cause more impulsivity, and as well as problems at school or work with attendance or academics, and then with the interpersonal note, working with the families and peer networks to work on interpersonal social skills so that they may handle conflict and handle situations where they may feel pressured to use. One method that is supported, has been researched but is not supported by research, is addiction medication for adolescents. Although it may be effective for adults, there's a lack of evidence for the efficacy of addiction medication, and there's not many studies on it, which is why the FDA has approved none of the medicines for addiction medication. The last one I'd like to talk about tonight is the recovery support services. And so these are not really a substitute for treatment. It's not really a route of treatment, but more as some would say, a maintenance dose. And so this would be coincided with behavioral or family-based or both approaches. And so what recovery support services are groups and communities that provide a community setting where fellow recovering persons and other therapists and effective role models can share their experiences, provide mutual support for each other with drug and alcohol abuse, and other ways to live a substance-free lifestyle. And I mentioned that I would get back to online relapse program. This is a great opportunity for kind of into school and outside of school treatment programs integrating into one. So there's this one relapse program that was researched and found to be effective where students would take lessons online about relapse prevention and psychosocial skills to prevent relapse. And again, this is a recovery service to help prevent relapse and keep the maintenance doses of recovery services up. And it is found to be effective, and it can be done in school because it is an online program. So I'd like to thank you for listening to the news, and we hope that you have learned something today. Thank you.